It's 2:00. I'm Olive Martini, and this is the Working on Wellness Radio Forum, which we do the second Wednesday of every month. And my guest today is Dr. Joshua Jones, and he's going to talk about telebehavioral health and you, and what you should know about the new ways of providing mental health care. Dr. Jones is a board-certified general and forensic psychiatrist and a well-established physician in Clallam County. He's the former chief physician's officer at Olympic Medical Center and the medical director at Peninsula Behavioral Health. Welcome, Dr. Jones.
So great to be back with you.
Well, it's wonderful having you. This is the first time I've ever had the opportunity to interview you, so it's great meeting you. Tell us, what is telehealth?
So telehealth is the provision of medical services or medical care over any telephonic device. So over the telephone, audio, visual, even asynchronously or not at the same time over email or other messaging system like that. It's not actually new. It's been around in some form or other since the early 1900s. And the first, real telehealth that we would think about, like both audio and visual communication, was used back in a state hospital situation in Nebraska in the late 50s. But it's really, any communication over any telephonic device to allow us to bring medical care to somebody who's not sitting right in front of us.
Okay, and how do you feel about the audio video, or do you prefer, do your patients prefer just over the phone? Does that make them feel more comfortable?
It widely varies. Mm-hmm. And so telehealth is being used for all sorts of specialties, my specialty being psychiatry and behavioral health, but telehealth is being used for family medicine and even, very specialized medical consultations such as oncology or cancer care or other sorts of care. So the current best practice is to have both audio and visual, so two-way television communication between the physician or provider and the patient. You can do right now. You can do just telephone or just audio treatment for some individuals, but it highly varies, and it really depends on what is the best or the most accurate way to duplicate or get as close to duplication as possible the face-to-face experience.
What kinds of medical care is delivered via telehealth?
So in psychiatry and behavioral health, a lot of counseling and therapy can be delivered over telehealth. It works very well, and scientific studies have shown that the outcomes or the benefit that the patient gets is pretty equivalent in most cases to face-to-face. But telehealth can be used for a wide variety of medical specialties. Family medicine is using telehealth quite a bit. And so folks who have chronic conditions that they may need to go see their physician or provider every so often, such as with diabetes or COPD or other conditions. A lot of those chronic conditions can be managed very effectively with telehealth as part of the care package. There's always going to be a role for face-to-face and hands-on doctoring. But telehealth can make it very easy or more accessible for someone to get care that they may not otherwise be able to get because of preference or distance or other factors.
So when you're working with your patients, do you do like a Zoom call, like once a month, once a week? How, depending on their needs, how does that work?
Yeah. So if you're doing an approximation of outpatient therapy, then you could do a Zoom call or other platform as often as is needed. So if you're doing regular outpatient therapy, that might be every week or every other week, and either use Zoom or another platform. Mm-hmm. There are lots of commercially available platforms for physicians and providers to purchase that have a little bit higher encryption to make sure that the connection is secure with patients. currently, my role as the medical director for the Providence Health Services telepsychiatry program is I'm providing care in an emergent setting. So to people in emergency departments and medical surgical floors in 42 hospitals in the 5 western states that they wouldn't otherwise be getting. So to, for instance, hospitals such as Grays Harbor is one of the hospitals we serve. They don't have any psychiatrists there. So if there's a patient who goes to the emergency department for a behavioral health emergency or up on their medical surgical floor and needs a consultation, they'll call us and call us. That's very simplistic, but they'll ask for a consultation for us, and we will beam into them on a cart that has a monitor that's placed right in front of the patient, and then we can talk with them, talk with their doctors and their nurses, look at their electronic medical record, and provide them with the best care possible.
So most of your patients are referred? Is that
for me now, in the practice that I'm doing, all of them are referred. All of them are either emergency department patients or have already been hospitalized at acute care hospitals for medical or surgical needs, and then also end up having some behavioral health concern. I will frequently see patients who have become either anxious or depressed while they're in the hospital, and their treatment team will ask for some additional care for them, or they come into the hospital because they have their mental status has been altered in some way, and then we have to figure out what's going on and what we can best do to help them.
So why is telehealth a thing now?
Great question, and I bet you can figure out why it's popped up since 2020. And the main reason that it's really exploded is because of the pandemic. So telehealth was available prior to 2020, but the rules that the federal government put down about how you could get reimbursed or paid for those telehealth services were really strict. But then the pandemic hit, and it became vital to our national health to be able to provide medical services not face-to-face, not breathing the same air, quite literally. So they loosened a lot of the probably pretty unnecessary restrictions on what types of telecommunication devices could be used, what settings or places people could be in to be receiving that telehealth, and then changed how they reimburse for it, and they pay for it a lot more on par with face-to-face care. It used to be before the pandemic, I couldn't see you at your home. If you wanted to do telehealth, you would need to go to a clinic, and maybe not the clinic I was at, and I could see you clinic to clinic, but I couldn't see you at home and get reimbursed for it. So it prevented a ton of telehealth services at that point.
So now someone could call their psychiatrist from their home, speak to you, or another psychiatrist, yes?
Correct. Yeah, correct. And you know what? We find that makes it a lot more accessible. People can have a lot more flexibility of the time of the day that they can arrange with their therapist, psychiatrist, or physician for other medical needs to be seen. And especially in behavioral health, it tends to take away a lot of the stigma of getting up out of your house and going to, the psychiatrist's office, or the anxiety that someone may be being treated for of going and sitting in front of somebody. It's really opened up a bunch of new worlds.
What is your new role, and what is your team doing?
Well, Olive, since November of 2023, I've been the medical director for Providence Health System's telepsychiatry program. So I oversee a team of 13 psychiatrists and 14 social workers who evaluate patients, usually in emergency settings, either in hospital emergency rooms or medical surgical units in 42 hospitals in 5 states. We cover parts of the Providence system from Anchorage to Santa Rosa, California, and to Montana, as well as Washington and Oregon. So about 3 times a week, I'll sit down in my home office with several computer screens in front of me and a camera and a headset, and we'll look at what consultations or requests to see patients these sites have put in during that day, and then I will, do what I used to do face to face. I'll review the patient's chart. I'll find out what the question is, and then I will beam in, and I'm using air quotes with my hands, beam in to a screen that's put in front of the patient. So we're having a two-way FaceTime type conversation. Talk with the patient. Do all the doctoring things that I have done face to face for many, many years. And then I'll communicate both with the patient and their hospital team on ground what I think they ought to do. And in this way, me and my team can provide psychiatric consultation to hospitals that otherwise really wouldn't even be able to afford or wouldn't be able to attract, very needed behavioral health services. So for instance, up in Alaska, up in Homer, Alaska, they don't need a full-time psychiatrist. In order for them to get one that would cover their emergency department 24 hours a day, 7 days a week, they would need to find 4.2 psychiatrists to cover that whole time. But with our team, we've got 14 psychiatrists spread across the country that can pipe in and beam in when they need, not just be standing by up there in Homer, Alaska all the time.
That's very interesting. And so you work with all kinds of mental difficulties?
Absolutely.
Dementia, all that kind of thing?
Runs the gamut. Mm-hmm. Yeah, absolutely. Anything that can bring somebody into an emergency department. So folks with suicidal ideation, folks with a chronic psychotic illness who are having an exacerbation of their schizophrenia and hallucinations, delusions, overdose, people with chemical dependency issues who present in the emergency department. Really, we see everything.
And so you're working with their physicians if they need to take medications and that kind of thing?
Absolutely. Yeah, that's what we call our bread and butter, in fact.
And so it works.
It does. We certainly think it does. And the scientific studies that have compared telehealth, both psychiatry and other specialties, to face-to-face care, show that telehealth is in many cases, not all, in many cases, as good as face-to-face care. A lot of it's going to depend on the person's preference. If you're in the emergency setting, sometimes you really can kind of take what is available, and so it tends to work there. But a lot of people are either choosing telehealth, or in many cases, because we have such a shortage of physicians and other providers in this country, it's what's available. Telehealth takes a concentrated resource, so physicians who primarily tend to congregate in urban areas, and spreads it out over a wider distribution, so to rural places like ours.
So how does that work when someone has never met you before, or one of your other physicians? How do you break the ice with them and kind of get them used to speaking to a computer screen instead of person to person? And do they see the same psychiatrist every time?
Yeah, great question. So introducing oneself over telehealth is a lot like introducing oneself face-to-face, but you certainly acknowledge, hey, I'm going to talk with you over this screen. We always get informed consent from patients about, hey, is it okay that I talk with you over this computer screen since I'm obviously not right there? A lot of patients are pretty used to it now, so it's like, yes, of course, this is just the course of business. Otherwise, I'll spend a lot of time, as much time as the patient needs, to talk about why are we doing it this way? Is it safe? I get that question sometimes. Is the information that's being transmitted back and forth encrypted? And the answer is yes. What could go wrong? And the answers to that are that the signal can be interrupted, and that does happen fairly frequently. That some kind of glitch can happen. Most patients are pretty understanding, and we always try to be very humble about, we don't have control over, everything that happens. And so if there's an interruption, we'll pick back up as best we can. And the vast majority of patients find that it's not only kind of surprises them with how well it works and meets their expectations. Some folks actually end up preferring it over face-to-face care.
And so as long as their confidentiality is being addressed, they're more comfortable with telehealth.
Yeah, absolutely. And the risks for your confidentiality being violated are far greater from other parts of the healthcare system than from somebody hacking into the signal, the signal that's transmitting back and forth. It's far more likely that somebody physically on the patient's end will be wandering by the room and hearing something inadvertently. And those are all things that we guard against and have a lot of work with the patient as a partner to figure out, okay, is now a good time?
Yeah. What should someone accept if they're going to use telehealth?
Well, they should, if they're going to use telehealth, they should expect that they are going to, have to figure out with their provider how to use the telecommunication device and platform that they're gonna use. What that means practically is some preparation time, knowing that if you're a person who's not very good with computers or smartphones, that you probably need to spend some time either with a manual or with some online help or with somebody who you know and trust that can help you fumble through the first couple times of logging on with somebody. And then you can expect kind of the same things that you expect from a face-to-face interaction with your provider, that your confidentiality is going to be honored, that you're going to be respected, that you're going to have similar recommendations that might be given to you as if you were in a face-to-face situation. Another thing to expect, though, is that not everything can be dealt with over telehealth. So even if you're having a telehealth appointment, your provider might say, hey, this is a condition where I really need to lay eyes or hands or have some kind of procedure or reading taken face-to-face. And so I think that's a really important expectation for folks to have, that not everything can be dealt with over telehealth.
Okay, let's listen to Aqua. This is Dr. Jones. If someone is uncomfortable with giving information over the computer, or they're not really computer savvy or something like that, or how does that work with telehealth that your group is doing? You're getting to know them first so that it's not a shot in the dark. You're not dropped in, and tell us a little bit about how you put people more at ease at using this kind of system.
Yeah, great question. So for us, because we're seeing people in the acute care setting, they have an on-site physician who is prepping them and saying, hey, I'd like you to talk with a psychiatrist. It just so happens that this person is on the screen. So for me and my team, we don't have a whole lot of problems with that. But you're right. I mean, this is a new technology. This is a new way of interacting. It's also a new way of exposing and sharing very personal information with somebody over a telecommunications device. So I think the really important thing about that is this isn't going to replace brick and mortar medicine. It's an additional tool, and I would say that each individual patient has a right to advocate for themselves. And if you're told by your insurance or provider, hey, you have to do this over telehealth, if you really don't want to, find out what your rights are under your insurance plan, your coverage, to advocate for yourself to say, I'd really want to be seen, brick and mortar. I think one of the fallacies that we have in this country is that something that's convenient then becomes like a must do. And I don't think that's the way that it is. Now, as more and more things go telehealth, might you have to wait a little bit longer if you demand, if you want, if you exercise your right to be seen face to face? You might, but it's still gonna be your right. And so find out what your rights are by contacting your insurance provider and figuring out what they have available for you.
I can see this is a very easy way to get into it if you have a relationship before you could start the telehealth over the computer. I think if you have an idea of what to expect and you have a relationship with who you're having that conversation with, I think it would be very easy to continue using telehealth.
Yeah, great point. And actually, there was a very interesting study that came out of Kaiser Permanente that showed that that folks who had a previous relationship with the provider that they saw via telehealth had really, really good outcomes, had really, really good approximation of having the same kind of good results that they would have had from seeing that person face to face. If it's a brand new person, we don't have as good of information on that. At the end of the day, it always comes down to the relationship that you can build with someone who's providing you care. Now, I think that for the most part, you can create a good relationship over the phone or video, but only if you have the skills to do it in real life as well. So,
we're talking about telehealth, and we've kind of discussed because of COVID and because people are starting to use their computers and doing Zoom calls and that kind of thing. This is a great way to reach medical health professionals that you may not have in your community. So how do I access telehealth, Dr. Jones?
So the best way to access telehealth is to find out what you already have available to you. Your doctor's office may offer virtual appointments as an option alongside regular appointments. So ask your physician's office. And then also ask your insurance provider what they provide. I have a lot of folks ask me, hey, should I sign up for one of these commercial programs that you see advertised online? And I would say those might be right for you, but first find out what you've already got available to you. If you've got a Medicare supplemental insurance, find out from them what they have available. Most insurance carriers at this point in time have some telehealth services that you already have access to. So first, talk with your doctor's office and see if telehealth is available through them. And then second, talk to your insurance carrier and see if telehealth is an option available through them. And then they will be able to instruct you on what computer application platform that they want you to use to access that. And
you can find out what telehealth would cost doing the same thing?
Exactly right. And so and that the cost issue is very important for a person to talk to their existing carrier about. Use the thing that you're already paying for before signing up for a commercial service that may cost you extra. You may find out that you're already paying a little bit of your regular premium for a service that you're just not using yet.
And tell us a little bit how this works for veterans.
So the Veterans Administration is using telehealth in various ways to reach out to folks, especially because we have veterans all over the country, and you have Veterans Administration clinics or hospitals only in certain places. A lot of veterans have post-traumatic stress disorder or other psychiatric conditions that make it difficult, awkward, or very frustrating to go to individual appointments. Telehealth can be a way to bridge that mobility gap or that anxiety gap of getting people care.
Is telehealth going to replace my doctor's office?
I don't think so. I don't foresee a situation in which that happens. There's always going to be a role for brick and mortar medicine. There's always going to be times when you need to have a physical examination, when your physician needs to sit with you and figure out, okay, why is your elbow doing that weird thing? Although there is some orthopedic care and some surgical care that's being provided, at least evaluations over telehealth, actually getting down, doing surgery, doing procedures, doing manipulations of the body is always going to be an in-person thing.
Well, let's talk a little bit more about how it's safe to use and how you keep things private.
Yeah. So it starts with you as the individual patient, knowing that when you log into telehealth, you need to be in a physical location that is safe, that is private, that you can control who's coming in and out and who's hearing what you're saying into the computer. The encrypted communication back and forth on any one of the commercially available and necessary computer programs keeps that information that you're transmitting back and forth to your provider very private. And then the provider on the other end has the responsibility, and I think most people do it extremely, extremely well, of making sure that they're in a quiet, safe, and private place when they're talking with you.
Let's talk a little bit about artificial intelligence. And does it have anything to do with telehealth?
Boy, artificial intelligence is the next big tool in medicine. And I would say that the answer is a qualified maybe. Artificial intelligence is really, really good right now at creating language. So these large language models that you and your listeners may have heard of, such as ChatGPT, can make up a lot of words. It's not yet to the point where there's widespread usage of artificial intelligence to help physicians and providers make decisions. It's probably coming. There are some issues that definitely have to be worked out. One of the issues is privacy. In order to get these large language models to give us useful data back, we've got to give it information about you, the patient. Making sure that all that is kept private is a challenge that a lot of commercially available artificial intelligence systems haven't quite dialed in enough to be able to be useful. The other thing that artificial intelligence and the designers of artificial intelligence are trying to tackle is that sometimes artificial intelligence engines hallucinate. That is, they'll give you results that are really kind of wild and out there. And sometimes those can be very creative and can lead to new ideas. But it's not really what you want in healthcare right now. So we have to figure out ways of making those types of deviations from normal care identifiable and easy for the physician who's on the other end of the artificial intelligence model to weed out and make sure that they're doing what's best for you, the patient.
You see that happening for psychiatry to use artificial intelligence? I mean, how would that be helpful?
Yeah. So for one thing, I think for some very kind of mild conditions, you may find yourself chatting with a chatbot, with an artificial intelligence chatbot, back and forth, and having it provide not therapy, but some education about your condition and answering some questions that you might have. Another way that artificial intelligence, how I really want artificial intelligence to help us out, is that, since the advent of the electronic health record, whereas you don't have a paper chart anymore at your doctor's office, but everything goes into a computer, we've compiled massive amounts of information about each patient. Now, it's kept very secure, and it's in, for instance, at Olympic Medical Center, they use the EPIC, electronic health record, but it compiles a lot of information that your doctor has to weed through to figure out what's going on. If we have artificial intelligence that can crawl through your chart and provide me with a summary, a smart summary of what's gone on with you in your life, that'll save a tremendous amount of time and may actually do a better job than I would do trying to manually comb through all those records.
Okay, now that makes sense. So you've got a new thing that you're doing, a podcast, and we're going to use about the next 15 minutes talking about your new endeavor, and it's called Cinemental. And I am very curious about what this is, and you and your brother are doing a podcast, and so tell us about that. Tell us what you're doing.
All of this is a labor of love for us. So Cinemental, spelled Cinemental, Cinemental Podcast, is available on YouTube and all major podcast platforms. And my brother, Jeff Jones, and I have gotten together to talk about mental health in movies and television. So my brother, Jeff, is a screenwriter and an agent in Hollywood, and he's also a professor of screenwriting at Cal State LA. And we decided about 6 months ago or so that we were going to take my psychiatric expertise, his expertise in filmmaking, and dissect different movies and television shows and tell how well they portray mental health. What did they get right? What did they get wrong? And what does the listener need to know? And so we'll take a movie such as we took Silence of the Lambs, for instance. It's our second episode that we dropped, and we talked all about psychopaths and all about serial killers and all about the psychology that goes behind obsessions and ritualistic murder and things like that. It's not always as dramatic as that. Our most recent episode, we talk about The Sopranos and some of the psychology behind the mafia and then the relationship between Tony Soprano and his therapist that goes throughout the whole series. It's fun. It's enjoyable. My brother and I have known each other obviously for 42 years, so there's a lot of joshing back and forth. Not necessarily something you should listen with the kids or the grandkids. We do use profanity quite a bit in very respectful and important ways. And yeah, we drop an episode every Monday at 9 a.m. And it's something that it keeps us off the streets.
So your brother's in California.
He is. Yeah.
You're here in Sequim, and so you're doing this once a week?
Correct. Yeah. We do it telehealth style. We do it both with audio and video. So the video feed is on YouTube, and then the audio podcasts are on Apple Podcasts, Spotify, all the major podcast carriers. It's been really great to reconnect with him and to talk with people about mental health. I've been pretty impressed with how accurately many of the movies and TV shows that we've chosen thus far have portrayed mental health. When they don't portray it very well, especially in a way that makes it more stigmatizing for somebody who's affected by a particular condition, I'll call that out. I'm not about that at all.
Well, let me give you the weather, and then we'll be right back. This afternoon's weather forecast is made possible through the support of All Weather Heating and Cooling. The National Weather Service says this afternoon will be sunny with a high near 61. Mostly clear tonight, low around 45. Sunny on Thursday, high near 70. Sunny on Friday and 74. Sunny on Saturday and 73. Mostly sunny on Sunday and a high near 67. Partly sunny Monday with a high near 62. Partly sunny on Tuesday, a slight chance of showers with a high near 62. A small craft advisory is in effect for the local waters of the Strait of Juan de Fuca until 2 a.m. Thursday morning with winds from the west, 15 to 25 knots. This afternoon's weather forecast is a service of the KSQM News Center, made possible through the support of All Weather Heating and Cooling. Well, we're here with Dr. Joshua Jones, Medical Director for Providence-St. Joseph Health System, and we've been talking about Telebehavioral Health and what's on the horizon. And so to wrap it up here, this has been something that is new to a lot of people that will probably happen more and more. And as a summary, kind of tell us what you like about it and where you see it going.
Well, what I really like about it is the ability to be in one physical location but be able to affect so many lives. So in my role, I'm able to be in one spot, but in any one given day, I can help patients in 10 or 12 different hospitals throughout the West Coast and beyond. And that's really the promise of telehealth, is to take a concentrated resource and spread it out over our vast nation. I want people to not be afraid of it. I want people to know that telehealth can be helpful, but also that it has limitations. It's not going to replace your doctor. It's not going to replace hospitals. It's not going to replace, needing to and getting to have the healing hands of your healthcare professional touch you and help you to heal. But it is a tool that can be very effective. You need to learn more about it. You need to ask your doctor's office and your insurance carrier what's available to you, but also not take it as law that you have to use it. If you really, really want in-person care, advocate for yourself and make sure that that's what you can get.
And do you find that people, if they don't think that they need mental health care, how do you work with someone that says, no, there's nothing wrong with me, I don't need this?
Oh, all of that is such a massive, massive topic. Maybe that's the topic we should do next year. Yeah.
I don't need this. Yeah. Nothing wrong with me.
The number one thing to do in that situation, if you're a healthcare provider or if you're a family member trying to convince somebody that they need help, is to stop talking and listen. Listen to the person, listen to your loved one about why they think things are going great for them. Usually you'll find out that they don't think everything's great. They just don't agree with you as to what the issue is. So if you can listen, have patience, if you can, and find something to agree on, that's usually the way to help somebody who doesn't necessarily want help in that moment.
Well, thank you so much for coming in. This is a presentation working on wellness as a health education program of the Dungeness Valley Health and Wellness Clinic, SQM's free clinic. The clinic provides basic urgent care and chronic health care services to the uninsured in our community, and they're open Monday and Thursday afternoons at 4:30, and they are at 777 5th Avenue around the back. Dr. Jones, it was a pleasure, and we'll talk again next year. Maybe we'll talk about how the middle child and the oldest child and the youngest child. We'll talk about that next year.
Absolutely.
Doesn't that sound like fun? We'll talk about only children.
Olive, I'll talk about anything with you. Thanks so much for having me.
Thank you for coming in.